All right, I'm going to do a little overview of public health. And if you take the Introduction to Public Health class, you might have remembered that 10 essential public health services relate to three core functions of public health: assessment, policy development, and assurance. The reason why I keep mentioning policies is they are critical into addressing systems. And one of the big things is assessing things to make sure that we need um, different things in our society. So we monitor health, we diagnose and investigate, we do policy development here to inform, educate, and empower, mobilize community partnerships, and we develop policies. These policies can go into laws, they can require people to be linked to provided care. We can assure compliance workforce, so in other words, creating policies that do this, and then we evaluate these things to make sure that they're working. Now, let's make sure that we have a good working definition of what a policy is. Um, Policy is a set of ideas or plan of what to do in a particular situation that has been agreed on upon by an official group of people. So this could be a board of directors, this could be a school board, this could be your housing association, it could be your rental agreement set up with a group of a housing association that has a board, a business organization. So yes, businesses can set policies. A government can set policies that can go into laws. A political party can set policies. And so this translates into setting up policies that can affect the different programs. It can set laws. And so you'll see constantly we're talking about this. Now, within the framework of health and social justice, and I'm just going to focus in on this class here, we talk about it because we look at health conditions, and then we look at policy, we look at living conditions, inequities, and social inequities, and we think about what are the things that we could do, policies that can affect living conditions. So for example, when we talk about diabetes type 2, we really focused in on how living conditions can impact that. So a policy that can affect a living condition could be regulating that more grocery stores go into certain areas, or creating policies that address the lack of distribution of funds for transportation for that area, or raising up and advocating for an advisory board with youth that are lifting up their voices and talking about how land use is happening, housing is happening. And this is affected by policies. These are regulations, rules, things that lift that up. And I highlighted the Food Trust Organization. I highlighted the Rural Health Initiative. Then we also talked about policies around institutional inequities. And these definitely affect living conditions also. This could be laws and regulations about cultural diversity, making sure that we have policies that have diversity and lift up and include different voices on a board, or create policies that lift up and make sure that we do not have implicit biases, social inequities, doing trainings. Other policies that can affect these different areas also could be policies around drug prescriptions, lifting up and creating different regulations on when things could be prescribed and when they can't be prescribed, putting treatment resources in there. So when we look at policies, they're very powerful in capacity building, community organization, civic engagement. Policies affect change. And every single health condition that we brought up in this class, I lifted up a policy and talked about a policy that could impact that. So when you think about whatever condition, whatever health condition, realize we talked about policies too, from targeted marketing with tobacco and addressing policies to change that. Opiates, mental health, police reform when it talks to incorporating mental health. Think about that framework and realize when I go back to policy, I'm going back to that definition of what particular situations that are ideas or a plan that are include a group of people, and it's been agreed upon by a business organization, a group of people, or a political party. And so policies are critical when you start talking about systemic change, because you can't just bring a health education program in and plop it in and think it's going to make a systemic change. You have to think big picture. How can you embed that to make it a policy that impacts more people across different systems?